Well, thank you. So, what new guidance are you expecting to hear?
It's a good question. I anticipate that we're going to be limiting PCR testing just for essential workers and healthcare workers and symptomatic people with known exposures. And for people without symptoms who have suspected exposures but not known, will probably be asked to isolate and maybe use rapid tests. I also suspect we'll be relying more heavily on rapid tests rather than PCR tests. And maybe, I hope, announcing the creation of a central registry whereby people at home can report the results of their rapid test to public health.
We have heard about people facing long lineups, waiting to get appointments. Why, in your view, has it been so difficult to get a test?
Because we have an unprecedented number of people suddenly exposed and showing symptoms. This is the nature of Omicron, which is so incredibly contagious that a lot of people, maybe even everyone, is going to be exposed in a short period of time. So the testing apparatus was not designed to handle this volume of requests in this short period of time.
We get these numbers every day that are going up every day because of this backlog with people unable to get the tests. Do we actually have a true picture at this hour of COVID?
No, we don't. We have a poor picture. It's like driving blind in a blizzard in many ways. But we do know that the cases are off the scale, and we can estimate based upon the test positivity rate how much off the scale it is. And I've heard one estimate that we're getting 1 out of every 5 cases is being registered via the PCR testing right now. It's going to get worse. So it poses a bit of a challenge to modelers and epidemiologists in the next few weeks when we have to use other tools to validate the modeling data and get a sense of how far along the wave we are.
When you do see something like a 20% positivity rate, what does that say? What does that mean?
It means we're missing a lot of cases. We're not testing enough, obviously, and it means that the disease is penetrated heavily into the community. I cited the 1 in 5 number. That comes from the test positivity rate. It suggests we're just missing a lot of cases.
So this could then potentially change how we track all these daily case counts if we actually get more of these tests done.
Yeah, absolutely. There have been some calls from clinicians that we should be relying more on the hospitalization data. And that's true if our goal is simply to monitor how well the healthcare system is doing, which, by the way, is our primary goal. But we have other goals too, and those goals include keeping track of the progress of the epidemic, understanding how deeply into the community it's spread so we can protect kids under 5, for example, who can't be vaccinated. So to do that, again, we're going to have to use different tools to estimate the extent of cases in the population. The hospitalization data will help, but if we can get a hold of the results of rapid tests, that will be useful as well.
How prevalent do you think COVID is right now, especially Omicron?
It's really prevalent. So Ontario is announcing 8 to 10,000 cases per day. It's probably 4 to 5 times as many per day, frankly. Modeling suggests we're looking in Ontario at 60 to 100,000 cases per day in a few weeks. It's going to get really, really quite prevalent soon. The question is, will that number bleed over into our healthcare system? It probably will. So there's a bit of concern.
Yeah, and so a lot of these, too, are those so-called breakthrough cases where people are double vaccinated and still getting infected. This could raise questions for people. Does this mean that a booster shot, 3 doses, is actually what it means to be fully vaccinated?
Yeah, that is the prevailing theory right now, that this is a 3-dose vaccine. To be fully vaccinated, you need 3 doses. However, 2 doses is very good to prevent serious disease and hospitalization. That's really what we're seeing here with the supposed mildness of Omicron. It's because Omicron has a higher rate of breakthrough infections than did Delta. And as a result, Omicron is affecting more vaccinated people than did Delta. I phrase that a specific way. I'm not suggesting that vaccinated people are more likely to be infected. Not at all. The unvaccinated are still at highest risk. But because Omicron has a higher share of vaccinated people than did Delta, it appears to be milder because lesser likelihood of entering the hospital system. That's for 2 doses. 3 doses reduces the probability of being infected in the first place and will slow down transmission. So getting 3 doses into more people will help enormously.
So if Dr. Kieran Moore announces that there will be limitations on who gets these PCR tests, how do we make sure that the regular population can get access to the rapid test? Because you hear that as well.
This is a big question, and the USA, they're pushing I think, the Defense Production Act to produce more rapid tests to flood that country with more rapid tests. The rapid tests we're going to be leading on more and more. How do we get more? Well, we have to purchase more at the governmental level. We probably should have made this ubiquitous at this point in the pandemic. Everyone should have free access. Now, how do we use them? If they are scarce, they're probably going to be reserved for confirmatory testing for healthcare workers, for example, and essential workers to get back to work after they've had a few days of no symptoms. If they are more common, then we can use them as common citizens on a regular basis to test ourselves for infectiousness. And if you're empowered with the knowledge of whether or not you were infectious on a certain day, then you can control your exposures, and that will help as well.
Before I let you go, Dr. Moore was set to have a news conference yesterday, but then postponed it, saying that he had to consider some new guidelines. I gather it is the new guidelines from the U.S. Center for Disease Control, which now suggest that people self-isolate for 5 days, down from 10.
Yeah, the CDC recommendations are interesting. Some of it makes sense, some of it is not science-based. The scary part about the recommendations is that they're suggesting no negative test is needed to re-enter society, and that's a mistake to my mind. Regardless of how long the isolation period is, two things need to happen. You need to be asymptomatic, and you need a negative test, even a negative rapid test, to ensure that you're not infectious before returning to exposing yourself to other people.
Well, Raywat, thank you very much for sharing your insights with us this morning.
Thank you very much.
That is Raywat Deonandan.
Thank you very much. Thank